So the MiHIA Dashboard Health 4.0 can be accessed from MiHIA.org and coming right over here to the Health Dashboard. Or you can also go to dashboard.mihia.org and it will bring you to the dashboard itself. Dashboard 4.0 creates a common place for data to be obtained, allowing individuals within the region to gain a quick access to information that can help improve the overall health and status and quality of life for communities throughout the Great Lakes Bay region. Here you can find a centralized public platform to share health, equity, and quality of life data using data visualizations for over 330 indicators from 40 sources. The homepage itself has easy access to find items such as data, disparities, grants, reports, as well as upcoming events. At the top here, we do have the navigation bar that allows you to have quick access to the information you're looking for. For the tools and resources, it takes you to where you can find data and reports on the dashboard. The Get Involved tab allows you to go to additional resources and allow those visiting the site to submit resources such as funding opportunities and promising practices. And last but not least, we do have the Bloom scorecards. So for that, we're actually going to jump into one of the scorecards, which is the MiHIA Region Bloom scorecard. All right. Here, you'll be able to find the Blue Scorecard report for the MiHIA region as well as each of the 14 counties within here. The scorecard report itself pulls out a select economic and health and well-being indicators to easily track over time and compare within the region. These indicators automatically update as the source updates so that it shows only the most recent data. Many of the visualizations here are interactive. So you can see they are interactive when you hover over. And you can download and save each graph or chart by clicking the little hamburger icon here, which allows you to download as a JPEG, PDF, or CSV file. In addition to that, at the bottom of the page, let's go a little quicker down here, you have the opportunity to, there we go, click and print or export the entire report as a PDF. So that was just pretty much the Bloom scorecard report. Next, to learn more about the data on the site, we are going to visit the dashboard landing page. To get there, we come over here to Tools and Resources and then go right to Find Data. I have it already pulled up. Perfect. So this is the Community Health Dashboard. This is your landing spot to find data on the site and complete detailed search of all the data that is available. We do have a couple of features of how you can do the search. For example, the first feature we have is to search by keyword, where you can type directly into the text box and it will pull up all related indicators that you can jump directly to. So for example, if you wanted to search something such as poverty, there you go. You'll see that these are all the indicators related to poverty that we do have on the site itself. For knowledge bases on our platform, an indicator is something that describes an aspect of the population. So that is what we use to measure the health or quality of life. In addition to searching by keyword, you also have the option to search by the indicator drop down here, where all the indicators on the site are organized by health topic first and then subtopic alphabetically. So again, if you typed in poverty in this section, it will pull up the same indicators that we saw on that list, but just within their subtopic area. And then last but not least, you have the option to search by location. All locales on the site starts with the largest and then goes down from there. So it starts by the state, region, county, and then we also have census places and census tracts. For example, if you're not aware of what your census tract or census place may be, we have this cool little feature here to the right that allows you to utilize the map to search. So if you click this right here, it'll pull up the map of the region. And then let's say if you want to look at the census tract and see where your location or community actually overlaps, clicking the census tract would populate the different areas where the census tract information is. And by hovering over the areas, you'll see which census tract is assigned to the area that you are focused in. Okay. That's the map on there. All right, in addition to the search feature, we also have some pre-built dashboards on this community health dashboard page. All of these are around specific focus areas. As you can see, there are brief descriptions under each of the dashboards that are located here that gives you a little bit idea of what each of these dashboards are focusing on and gives you more information about what you want to look into, in addition to seeing a full list of all the indicators and the location data available for them. So one of the first dashboards I want to go into to show all of you is the All Data Dashboard, which contains data for all the indicators at all locations that we have right here. Perfect. So this is the All Data Dashboard. This dashboard, again, displays all the indicator data for the region when available on the site. The indicators do come from both national and state sources, and the sources are updated annually. This currently displays all the data on the site for all locales. However, if you want to go to a more specific locale area, you can come over here to this drop down and specify the area. So right now we're looking at all the data for Michigan, but let's say we wanted to look at a specific county such as Bay County. We can click that and the dashboard itself will update. So when looking at the dashboard, we have it organized based on area. At the moment, we have it as Bay, and then you'll see that we have the topic area, subtopic area, indicator name, the value, the period of measure where the value was collected, as well as all comparisons available. In addition to what you're seeing on here, we have this great legend off to the left that is pop in and outable that allows you to see a little bit more information on what the comparisons are detailing. So this allows you to see how we are breaking down the comparisons based on distribution, how they are comparing to certain targets, as well as how they are comparing to single values. In addition to having this legend here, we also have this great more button at the bottom right corner that takes you to our help center that takes you to an article that goes more in detail about all the comparisons that you are seeing on the dashboard. So in addition to what you're seeing here, the comparisons as well as the indicators being rolled out on this list, we do have a feature here on the top left underneath the geographical drop down that allows you to see the data in card view. This card view, you'll see when we click it, it takes each indicator and turns it into a downloadable graphic. When you click this Save Card button right here, it allows you to save as a JPEG, which can be utilized for reports, presentation, or even grant writing. In addition to that, for those who may be color impaired, we do have a colorblind mode that when it's turned on, you'll see, there we go, some thumbs up and thumbs down around some of the comparisons. This will be a very great feature that allows you to, when you are printing out maybe in grayscale and those individuals are not able to see the green or reds around the comparisons, they're able to see how the comparisons are doing, comparing favorably or not favorably. So this is the All Data Dashboard. So now that we've kind of reviewed a dashboard itself, let's kind of look at what an actual indicator looks like and what that detailed page looks like as well. So for that, we can come right back down to the community dashboard and actually search for indicators. So let's say we're looking at access here. Come over here and type in access. And let's go to adults who have had a routine checkup as our indicator. So when you click into this, it will bring you to the indicator detail page. So overall, the indicator detail page is designed to give you more information about a specific indicator, including values for specific locations, changes in values over time, as well as details about different subpopulations when available. At the very top of the page here, you'll see that we have the name of the indicator and drop-down menus for locales and measurement periods. So right now, the county we are looking at is the Bay County. However, we wanted to toggle through other counties for a specific indicator. We can select from here. And then for the measurement period, it always shows the most recent period that we have data available. So for this, we do have data available from 2022. However, if you were interested in looking at historical data on this actual indicator, you can toggle through other years from here. Right under that, we do have the indicator definition. So this is what the indicator is measuring. So this is showing that this indicator shows the percentage of adults that report having visited a doctor for a routine checkup within the last year. Then right underneath that, we have the why is it important section. So this pretty much gives like a summary of why we are considering this indicator important. A lot of time, folks who come to the indicator detail page and they see this little brief blurb about the indicator, they're able to pull content and information from here when writing proposals for grants to kind of like summarize why they are trying to receive funding for a specific area, or even get data that support a finding that they are pushing forward for their grant or proposal. As you scroll down a little bit more, you'll see that it goes more into detail about what is going on with this indicator and what data is supporting it. So over here to the left area, it is kind of reiterating what we're seeing at the top. So the county that we are specifically looking at is the Bay County. Right underneath that, we have the value showing it 79.4. Next, we have the source data, so where the data is coming from. This is currently showing that it is coming from CDC Places. We have the measurement period of 2022, who it is maintained by, and then when this data was last updated. In addition to that, we come over here to the right, we are seeing the same comparison icons that we were seeing on the all data dashboard. However, on this feature, one of the fun things you can do when you do come here is that when you do hover over the comparisons, it goes into more detail about what you're looking at, as well as what the comparison data and values are showing. So, for example, with this one, the US value of the green arrow pointing up is showing 76.1. It is indicating that this 79.4 for Bay County is higher than a US value of 76.1, which is trending up and is green. So we're considering this as a good data point. As you scroll down a little bit more, you'll see that we do have some technical note as well as more information that can take you to how to use the CDC Places data. And then we additionally have some graph that shows data over time. So with this graph, it shows the data over time. And when you come over to this hamburger icon right here, it allows you to not only download this graph by JPEG, PDF, or CSV, but you also have the option of showing confidence intervals, like so, or even changing the the zero-based y-axis to make the graph tighter or tighter or wider. So there we go. In addition to that, we do have some mapping visualizations as well, that the map is also tied to a table and chart. You're able to overlay comparisons on the map, and similar to the chart above, both the map and the table are downloadable. So these can also be shared. And then scrolling down a little bit more, we have the table that is reflecting the data that is pulled up on the map as well. In addition to how the map is, this table can also be downloaded as a CSV file. So this is the overall indicator detail page. When you scroll all the way down to the bottom, you'll see that we have some additional resources that are available that tie into other indicators around the one that we're looking at. So you see adults without health insurance, children with health insurance. We have some links that take you to prompts and practices related to this indicator, some reports related to the indicator, as well as additional resources. So overall, this is what the indicator detail page looks like, and this pretty much gives you a summary of what the indicator shows, as well as how the data is being reported. So now that we've kind of gone over the indicator detail page, as well as looking at data and how to find data, we wanted to also take this time to show you how you can build your own dashboard and search the data on your own. So for that, we'll come right back to Find Data. That takes us to the MiHIA Health Dashboard, and then we'll come over here to this advanced search feature. Cool. So you'll see here, it takes you to advanced search, how to build a custom dashboard. So overall, users can complete a drill down search and create their own custom view of data from coming here. They have the option of doing hand-picked indicators for locations, or you can filter by specific locations as well. So for this example, we're going to just kind of go through how we can kind of use these filters here to build a dashboard for our own. So coming over to selected ones, first we're going to go to filter by actually, let's go back to this. Let's go to filter by topic. So seeing that this focus of this webinar is around optimizing health and care, let's go to a access topic area. So we're going to go ahead and select healthcare access and quality as our topic of focus. Perfect. Next, you have the option of filtering by population. So if you're looking for data for adults, children, infants, or other subpopulations here, you can select a group from this dropdown. You have the option to filter by classifications. So let's say if you wanted to see data specifically on social determinants of health, you can come here. Next, you also have the option of searching for or selecting comparisons. So for this one, comparison-wise, let's kind of have this comparison be compared by Michigan, the state of Michigan. Let's see. Let's do par value, trend over time, and a Michigan state value. Gosh, into there you go. There you go. Yeah, Michigan state value. Okay, so those are the comparisons we're going to choose for this example. In addition to that, if you want to see a subgroup data such as age or gender, that can also be selected through here. And then last but not least, we have this filter by sources option that allows you to see one of the places where you can see all the sources available on the site. So if you wanted to just find data specific to, let's say, the American Community Survey or even CDC places, you can select that source from here and it will filter just from that. So now we kind of filled in the areas we wanted to filter for this dashboard. We're going to come over here and say group by location and press search. All right, and then as we scroll down, we have built our own dashboard. So as you see, the dashboard pretty much resembles the all data dashboard that we saw previously, where you see the topic area, then subtopic area, values, and then comparison values. You can see how we are comparing. So if it is red, if it is green, if it is up or it is down. And then with a trend over time, you can see that when it is a filled background, it means that that there is a significant trend, whereas if it is a blank / not filled background, it is indicating that it is not statistically significant just yet. So overall, these are just a great way to kind of see a good snapshot on the site of the data and how they are flaring together. In addition to that, for the dashboard search that you do, you also have the same feature of changing the information to be viewed as a card view. So you're able to see the breakdown like this and still have the option to save each card individually. And then if this is a dashboard that you think you may want to revisit or even share with other colleagues or individuals in your organization, you're able to come to the Save This Search link and copy this, and this URL can be used for later and shared with a friend. So this URL, once you have it created for your dashboard, will always be something that you'll be able to access, and this link will remain the same even as data updates. So if you wanted to share and actually have this saved, this is a great feature to have on this. Okay.